Hi guys, it is Tamara. I, thought that I would kind of record a short video for you and, just kind of mention some things that I just experienced. So I've been seeing clients all throughout the COVID pandemic, and I've been kind of seeing them using a hybrid model, meaning that I do some online sessions or teletherapy, and then I also do some in-person sessions. And, I have found that to be rather successful in treating clients who are dealing with, depression, anxiety, triggered PTSD symptoms, and the list goes on. So, I have been able to, treat clients that way and keep clients and kind of give them the help that they need. But I wanted to kind of record this video because I just experienced a 8-year-old who is having a very, very hard time wearing masks. Now, this is a controversial issue, and one of the reasons why is because the CDC, the Center for Disease Control and Prevention, basically says this, that masks, although they may not be 100% protective, they have a high percentage of success, meaning that they protect us from any kind of airborne viruses or disease that may impact us or infect us in a way that is not good. So, that has been the message. Now, the new message is get a vaccine, right? Get your first dose, get your second dose, and everything, so sorry guys, and everything will be just fine, right? And I think we have very, very poor messaging. We have very poor education as well. And some of my kids who are between the ages of 8 and up, right? 8 and let's say 19, they're having a really hard time with the messaging associated with getting vaccinations and, having to wear masks. So, we have this big message that says that if we wear a mask, if we get a vaccination, that everything is going to be fine. And unfortunately, that's not the case. So there's a couple of things that I have seen in my practice, and, for people who have, really faithfully stuck by the rules of the CDC, they're kind of getting frustrated. And, some of those people come to my practice. Other people consult with me online. And one of the things that I've seen is that they are suffering from depression because they are made to wear a mask that we are naturally not supposed to have on around the clock, In what world are we supposed to have a mask on 24/7? Can you imagine what people are going through who have to wear a mask every day, all day to their job? My brother is one. He works for the government and he has to wear a mask around the clock. He usually works 12 to 14-hour shifts and he has to keep that mask on. And it's really difficult for children to do the same thing. Can you also imagine those individuals who, we're told that if you wear a mask and you get a vaccination, everything is fine, and then a family member dies of COVID? Can you imagine the children who are being asked to conform, not touch each other, put on hand sanitizer, keep a mask on, not eat next to each other in the lunchroom, don't sit next to each other, right? Put this mask on or this face shield. Some of my kids who go to public school have had to wear face shields. This is traumatic. And, I see the field of mental health is really taking a drastic shift after COVID. And I see that in a variety of ways. One way is the traumatic impact of having to alter one's lifestyle, wearing a mask, putting hand sanitizer on all the time, really having to not touch each other, hug each other, keeping 6 feet apart. We are human beings who need touch and we need closeness, most of us, and especially children, and we're being asked not to do that. That's really abnormal, and then on top of that, we also have the other traumatic part of, okay, get a vaccination and put a mask on and you'll be fine. And the reality of that is that some people have died even after doing that, even after following the rules. That's traumatic, you know. We also have people who have become really socially anxious and they're having a hard time. This is so shaky, guys. I'm so sorry. They're having a hard time getting through coming back out into society because they have been locked up in their home for months. And so now there's this social anxiety associated with having to come back out into the world and socialize and be a part of society. That is traumatic, you know, having to get back into the swing of things. So there's a lot, you know. Let me also mention too, guys, that there's another traumatic component to this, which is divorce. You know, I have seen a lot of divorce in my practice, and I have seen a lot of divorce around the world. Even divorces I thought that would never happen, they have happened during COVID. Why? Because, you know, you think you're compatible with someone until you have to be with them around the clock, and then you realize, wait a minute, we have nothing in common. We can't have a conversation. We don't like each other. We don't agree on this, on that. The children are miserable with us both home. Like, there's so many different dynamics and components to that, you know. So, you know, and last but not least, you know, not being able to go visit your elderly family members and having to drive past their home and beep the horn and have balloons hanging out the window, or, you know, put them on their front porch just to say Happy Mother's Day, Happy New Year's, Merry Christmas, right? Happy Thanksgiving. It is depressing. It is traumatic. It is abnormal. These are experiences, guys, that, you know, we are all having. Even myself as a therapist, I've had to readjust how I see things. I've had to put on my, you know, my firefighter helmet and get out here and put a mask on and counsel sometimes. You know, I've you know, worked with crisis teams, and I've had to go talk to people who are having a really hard time. Sorry guys, it's a blinding intersection. But and don't do this at home, okay? I just had this on my mind after meeting with a kiddo and thought I would put the camera on and give you guys a video. But, you know, there's a lot going on here, and there's a lot that we have to adjust to, and it's not an easy thing to adjust to. So we're going to have a major shift in mental health in terms of, you know, what we need for trauma-informed care. We're also going to see a major shift in insurance costs because people are going to want psychotherapy. You know, they're also going to want to utilize their insurance for medical services because of increased anxiety, heart palpitations, high blood pressure. The list goes on. So we're going to see a major shift, and I'm sure, you know, if not yourself, you know somebody who really has expressed a need for psychotherapy or has expressed a need for medical services. And, you know, because of that, you know, you're going to see a lot of people really needing help. And we're going to see a change in our society big time. So I figured, and now I'm here, you know, that's how it usually goes. But I think that, you know, there's a lot that we're going to have to deal with in terms of trying to rebound from COVID. So, you know, if you see yourself going through this, or you know somebody who is, I encourage you to let me know in the comment section below if you feel this way. And, you know, tell me how COVID has impacted you. I'm going to post a video right here for you. And I'm going to post another video right here for you where I talked about COVID. And I also talked about the impact that we have had to experience and kind of cope with. So I hope that would be helpful to you. I'm going to continue to talk about some things that you're likely to deal with in terms of mental health and trauma, family. There's a reason why I've been focusing on family so much recently, and it's because that's one of the biggest issues that we're having right now. So I will continue these videos. I'll see you in the next one. Bye.